Hi, welcome again to HRSCO Online, your online resource for information and education on custom foot orthotics, custom shoes and orthopedic devices. In this video, we're going to take a look at internal pedorthic shoe modifications. One of the more common complaints seen among patients is a leg length discrepancy, and this can vary from a few millimeters up to several inches. This can be addressed using heel lifts, such as this device here, made out of cork. Here's a 1/4 inch heel lift that extends from the posterior of the heel to the mid-arch. This can be layered up and put inside the shoe in order to address the imbalance that the patient has. However, there's only so much of a lift you can put inside the shoe before it starts to affect the fit. And very often patients will say that the shoe is now loose or that their heel is pistoning out of the back. Typically, we recommend a heel lift of no more than 1/2 inch inside the shoe before you turn to the outside of the shoe and try and put some elevation onto the midsole itself. We're all familiar with the use of metatarsal pads in order to relieve pressure at key spots such as the met heads on the ball of the foot. There are many different sizes and diameters of metatarsal pad that can be placed and glued inside the shoe. The advantage of placing a metatarsal pad inside a worn pair of shoes is that you can see exactly where the pressure areas are on the board of the shoe, and you can place the metatarsal pad in the appropriate position. This can be helpful if they need to wear it in, say, a tight pair of dress shoes where they wouldn't be able to use a foot orthotic in any case. If you need a little more arch support, you can glue in pads such as these underneath the medial longitudinal arch. These are scaphoid pads, and they're made of different materials. They can be made in different sizes and thicknesses and different diameters to give the patient the support and relief that best suits their needs. In cases where there's a bony prominence or an anatomical bone that needs to be relieved, it's possible to do an excavation inside the shoe itself. Using a die or a hole punch such as this allows you to excavate or remove a portion of the board-lasted shoe and then place a very soft material or a pocket of gel or PPT into the shoe. Although as pedorthists we'd never allow a patient to choose an ill-fitting pair of shoes, they'll often show up complaining of the fit inside a shoe. In those cases, it's possible to give them some relief by stretching the shoe, and there are several shoe stretching racks available for this purpose. If the bony prominence is more localized, such as in the case of a bunion, you can use the famous ball and ring stretcher, where the material is placed and you can essentially squeeze or blow out the leather at the side of a bunion or a hammer toe in order to give local and specific relief. The relief available from a ball and ring stretcher is limited, and often patients will expect miracles. But if you're finding that you can't get the right result, it's important that you educate the patient and help them choose the correct shoe, perhaps an extra depth shoe with a removable inlay, where you have more room to work. Finally, in cases where you're trying to prevent motion inside the shoe, either due to perhaps a metatarsal fracture or a hallux limitus, it's possible to add a stiffener. In the old days, they used to add steel springs to the midsole of the shoe, and this would most definitely prevent motion at the ball of the shoe as the patient went into toe off and third rocker. However, nowadays, I prefer to use thinner carbon plates. These are lighter weight, they're also removable, so that as the patient heals, it can be removed from the shoe and they can continue ambulating in a normal fashion. For more information on modifying shoes, both internally and externally, please go to hrsco.com, click on the Education tab, and read the article Pedorthic Shoe Modifications. Thank you once again for joining us at HRSCO Online.